Let's start with cholecystitis, which is acute or chronic inflammation of the gallbladder. This typically occurs when gallstones block the bile duct. Bile, which is stored in the gallbladder, backs up, and that gallbladder becomes distended and inflamed. Bile helps digest and break down fats. So when bile can't flow, fats are not digested properly. So what factors cause cholecystitis? Well, the most common cause is a high-fat diet because it stimulates gallbladder contraction and bile release. Other risk factors to remember for NCLEX include the 3 F's: female gender, fat or obesity, and 40, which is an age greater than 40 years old. With cholecystitis, clients will typically report right upper quadrant pain that radiates to the right shoulder. Remember, the gallbladder is on the right side, so the pain is on the right side. The pain typically flares up after fatty meals because fat triggers that bile release. We will also see a positive Murphy sign, which is worsened pain when the right upper quadrant is palpated during inhalation. Other findings include indigestion, nausea, and vomiting. We'll also see steatorrhea, which is fatty pale stools from poor fat digestion since the bile is not breaking down the fat properly. Finally, clients will typically have fever and an elevated white blood cell count from inflammation and infection. So what are we going to do for these clients? We start with diagnostics. An abdominal ultrasound confirms inflammation or gallstones. If the client is stable, we manage supportively with IV fluids, antiemetics, and analgesics. If the client is unstable or supportive care fails, a cholecystectomy or gallbladder removal may be needed. Remember, cholecystitis can be very painful. During acute episodes, keep the client NPO because every bite triggers bile release, which squeezes the angry gallbladder. Anticipate the administration of IV analgesics. NSAIDs like ketorolac are typically given for mild to moderate pain and opioids for severe pain. Finally, administer antispasmodics like dicyclamine to reduce spasms, which relax smooth muscles like the ones in the gallbladder.